Dr. David Wong, welcome to Project 100, mate.
Thank you for having me.
Well, thanks for agreeing to come, mate, because I know you're a very busy guy. And I got to declare I am let's call a patient. I definitely consult with David, and he's been not mine, but lots of people, but the person I go to over a long time through my previous general practitioner, who sent me to David like probably 20 years ago. First off, just to be clear to everybody, David, could you please confirm I've had no aesthetic enhancements done at your clinic?
Not through me.
Not through me. Well, that's sort of been the case. It could have been through somebody else, but
that's right.
Thank you.
Right.
No, I appreciate that. No, so Dave, to become a dermatologist, what does it take? So do you become a doctor of medicine first?
Yeah. So basically, you enter the undergraduate program and you train as a general practitioner. So you do 5 or 6 years at medical school. After you finish, you're usually required to have at least 2 years of postgraduate training. So usually intern, resident, and then you apply for a training position. And at the moment, training in dermatology is quite tight. So often people have a few years more before they actually get under the training program.
What do you mean tight? It's hard to get?
There are not enough positions.
There's not enough positions?
No.
So there's a lot of people want to become dermatologists?
There's quite a lot.
But they never actually get a role?
They don't get the role because training positions are basically subsidized by federal government. So they're at the teaching hospitals. There are a few public-private type situations, but there are only a few, and there's never enough. So, when people apply, there's always a long waiting list. You've got plenty to choose from.
Wow. So, how long is your sort of call it postgraduate course in dermatology or in specialization? How long is it?
So it's 4 years.
Another 4 years.
Another 4 years.
So how long have you been practicing as a dermatologist overall?
So I was quite lucky because I finished school at an early age. I finished med school in 1983. I got straight onto the program. And at that time, the program was only 3 years. So I was done in 1988. So I was 28 at that time.
So you've done nearly 40 years.
Almost 40 years.
Almost 40 years.
Yeah.
And you're still going strong?
Still going strong, but, looking now to the future, I think once you told me there's only so many weekends left in your life. So I'm conscious of that.
So Project 100 is about a couple of things. It's about, sort of a little bit, from a selfish point of view, it's me trying to work out what have I got to do to live to 100. It doesn't matter, we'll live to 100, but what are the things I need to be aware of relative to myself? And it's about me having access to people like you and you and I sharing stuff, information, and distributing that amongst our listeners when they wouldn't ordinarily have access to someone like you or have access to someone like me who has access to someone like yourself. And it turns out that apart from heart attacks or heart issues, cancer generally, general cancer, that's all types of cancers, are the second largest killer in the world today. Skin cancer is probably in Australia would be one of the highest ranking types of cancers that kill people overall. Would that be right?
That's correct.
So it's probably coming in second or third relative to breast cancer or something like that.
Yeah, breast cancer, bowel cancer. I guess the thing is that skin cancer is a big issue in this country. I think when I looked up some stats, it cost close to $2 billion.
Wow.
So that's a lot of money to pay for just skin cancer alone. So it is a big problem and it continues to be a big problem. If I look at I keep individual stats of how many melanomas I see. This gives me an idea of whether I'm picking up the melanomas early or late. And I think, since the beginning of this year, which is just over 3 weeks in, I've already had 10 cases.
Wow.
So
do you sort of get into the technical detail or the physics of why Australia might have more melanomas or more skin cancers than, say, other countries? Have you ever gone through that process?
I think, yes, there are colleagues of mine that are very interested in those sort of statistics. And, and statistics are how you interpret them. But basically, white people living in a country where there's too much sunshine. It's as simple as that.
And is it something to do with our lifestyle too?
Yeah, outdoors lifestyle. So, you think of the old saying, mad dogs and Englishmen are the only people out in the sun. Every other country, like even if you look at in Europe, all right, so the people often have a siesta in the middle of the day. They avoid the midday sun, which is the most damaging.
Yeah, so, we are in the middle of summer right now whilst we're recording this, and this is going to be posted in the middle of summer or a little bit, towards the end of summer, but it'll be definitely posted in February. Australians are becoming more aware of the dangers of skin cancer, or becoming more aware but just disregarding it just as much as in the past? Just in your opinion?
All right. In my opinion, I think people are better. I think, in schools, no play policy has been in place for quite some time. I think most parents are well aware of the dangers of sun exposure and get their kids to use sunscreen. But if we look back, it's generational change. Okay. So the change in clothing, the change in how we live. So many years ago, when we were growing up, going overseas for a holiday was very unusual. Nowadays, 3 or 4 holidays a year, people are going overseas, they're seeking usually a sunny climate. So they're getting more sun exposure as a total than what they would have used to be.
So in other words, they have 2 summers.
Yeah.
So they have our summer, and then when the Australian winter turns up, they take off overseas for a European
another
summer, for
summer.
example.
Yes, correct.
That's pretty interesting. So does it get down to that sort of fine details in a statistical sense in terms of exposure? Have you run any, or alternatively, are you aware of any studies that show that our tendency to get skin cancer or skin disorders as a result of too much sun has some correlation to the number of times we are exposed to the sun? I mean, by seasons.
I don't think there's definitely that research done, but I mean, the research showing that the more sunburns that you have in your youth definitely increases your risk of melanoma.
Yeah. Do you think that people, because when I was a kid, people put baby oil on.
Yes.
And I had a girlfriend, when I was 16, 17, who said, "Here, put that on." And I remember I got like ridiculously sunburned. Like I had no idea whether half an hour or an hour. I wouldn't even know how long I was in the sun for. But I remember being at home being really sunburnt. And but it was sort of considered a thing. It's some coconut oil, and you used to be able to get on Bondi, and there was a guy that used to spray you with coconut oil.
Correct.
Cook you.
Correct. And people used to do that every summer. Getting sunburned was like part of the ritual. I mean, I remember when I came to Australia in 1974, went to school, people said, "Oh, let's meet you down at the beach." I got burnt once. I never went back. I thought, I don't need this. Your skin's actually telling you it's painful. Why would you be doing it to yourself? But, if you don't know better or you don't think any better, you continue to burn. And every time you get your skin burnt, you've done damage to the DNA.
So let's have a look at that for a second. So you say we've done damage to the DNA. So please explain what that means. So we've got a layer of skin. What gets burnt, the top layer or the bottom layer or some other layer?
It depends on how much exposure that you have. So usually when you get sunburnt, that's usually UVB light. So in the spectrum of light that we get on Earth, we get visible light, UVB, and UVA. UVB light is the light that burns us, and it burns the top layer of skin, the epidermis, and generally we then sheet that layer of skin off. At the same time, usually when you've had too much UVB light, you probably also had too much UVA light. UVA light penetrates deeper and probably affects the pigment cells more. Probably is there. Those are the pigment cells, the ones that create melanoma.
Right. So there's something below the top layer of your skin.
Yes.
Yeah.
Yes.
And so, and I presume UVB and UVA are both coming out of the sunlight at the same time.
Yes, correct.
Yeah. So, so why would somebody more likely get burnt than, say, another person? Let's say someone my skin color relative to, say, someone who's born in Ireland and has got red hair and green eyes, and let's say much fairer skin. Why does their skin get much more burnt than mine?
I like using analogies when I explain to patients, and probably the most common analogy that I use will say, think of your skin like the paintwork in your car, all right? And you're either born with Rolls-Royce paintwork, maybe like your skin, or you're born with, once upon a time, Japanese cars were cheap, poor paintwork. And so if you don't have good paintwork and you're exposed to the same elements, then that paintwork is going to deteriorate more quickly. And unfortunately, we don't have any technology to give you a new layer of paint. You only have what you're born with.
Yeah, so does that mean then but that doesn't mean for someone like me that I can't get skin cancer?
No. I mean, okay, so let's say you're now 50.
Yeah.
And you're a Rolls Royce. And you're a Rolls Royce. And that Rolls Royce has sat by the beach for 50 years. Do you think the paintwork on the bonnet or the roof is as good as on the side? It's not. So, the amount of damage.
So I have been to see you, and you've taken off some, and we'll talk about the processes a little bit later, but you have taken off some things on my skin, burnt them off. they were basal something or other. What'd you call them?
No. So my recollection is the ones that I burn off are basically solar keratoses.
Keratoses, that's it. Yeah.
Yeah. So solar keratoses are they're low grade. They are abnormal cells in the top layer of the skin, but they're not invasive skin cancer yet. So they're precancerous. Some of them will never turn into cancer, but a small minority will given time. Depending on your age, if you're young, we actively treat. As you get into your 80s and 90s, depending on what your general health is like, we may not treat because it's not worth the discomfort or the disfigurement.
So in terms of discomfort, all I remember is you sort of had a thing, you zapped it. I mean, we had two different, we'll go through two processes. There was a couple of processes we did because I was on TV a lot of the time, and I remember saying to you, look, I don't want a bad red mark there. And we waited until another period arrived, and you put me through a bit more lengthy process with applying some cream, and you asked me to go in the sun, and they shone a light on me, and sort of everything dropped off. But if I hadn't have had that, I'll come back to the process. But if I hadn't have had those things done, maybe 10 years ago, what would be the case now? Do you think?
Chances are that you probably would have had something that needed to be cut out.
Cut out.
So more significant.
Yeah, more significance. So in terms of that particular, what did you call it again?
Solar keratosis.
Keratosis, right.
Yep.
So solar keratosis. So what does that look like? How does a person know they got solar keratosis?
So typically they feel like a bit of gritty skin. So it's like you've been to the beach and there's a bit of sand left on your skin. So you might touch it and you feel that there's this rough bit on your skin. You play with it, it seems to disappear, but within a week or 10 days, it's back again. So it's this recurrent bit of rough skin.
It was sort of like a scab, but not quite a scab for me.
Yeah, but there's no blood there. There's just a rough spot.
There's no blood there. And if you pick that off, does that damage you?
It doesn't damage you, but you often find that it feels a bit sensitive until the skin heals over and then the spot redevelops.
Right. So that is not cancer in itself, but it could form into cancer. Just let's take me through the treatments of those, because you did say when someone has one of those, maybe you don't do anything because of scarring and potential discomfort, etc. But I have to say, of the treatments that you gave me, I think I had like 2 or 3 different styles of treatments. I didn't have any scarring and I didn't have any discomfort. It was a bit annoying because I had to wait a couple of days for it to drop off after you did what you did. But what are the 3 treatments?
Okay. So the most common treatment that we use is just basically freezing with liquid nitrogen. So that's carried out by the doctor in the office, and it's like a cold burn. And because cold numbs the skin a bit, it's not as painful as if we were to use heat. And that's the most commonly used treatment. When people have a lot of spots, then, when you're having 30, 40 spots frozen, it's pretty unpleasant, particularly if it's on your forehead, because you get like an ice cream headache from it.
Okay? Oh, really?
All right. And I would also be a little bit reluctant to use too much freezing in someone that has a more olive skin, because the freezing can damage the pigment cells. So then you have white marks left behind.
Right.
And even if you were fair-skinned, if you freeze something really hard, you will create a white scar. So the next options are usually a cream. So it's a cream called fluorouracil. The trade names are Effudix that people might be familiar with. And it's a cream that people put on themselves. So it's not the doctor putting it on, it's the patient. And they can put it on anywhere from 1 week to 3 or 4 weeks. The longer they put it on for, the more inflamed and angry the skin gets. So I don't know if you remember, but a few years ago, Barnaby Joyce was using that cream. And so he had this red, crusty face when he was on TV.
Yeah, I do remember it.
And so it's pretty unpleasant. And most people that do it have difficulty wanting to do it again, but it's probably a very cost-effective treatment. And then the last treatment is what's called photodynamic therapy. This is what you had, where a cream is put onto your face. We generally put that cream on, leave it on for about half an hour. Then we put sunscreen on your face. Then we send you out into sunlight.
That's what you did, yeah.
Yes. The sunlight slowly activates the medicated cream, which has been more selectively absorbed by the abnormal cells. And that happens over 2 hours. And because the cream's expensive, we generally give you a bit of red light at the end of it to activate any residual cream. And that's like having done 3 weeks of Effudix in a row in 1 day.
And it seems to have, it's not as long of an effect, but it worked. So, my skin feels relatively clear. I mean, I always get nervous when I sit here in front of you. You're looking at my skin. I'm thinking to myself, he's just picked something out, especially because you have this look about you from your eyes. I'm thinking, what's he seen? So that's for that particular skin. Let's call it a skin disorder because it's not really a cancer.
That's correct.
What's next?
So after solar keratoses, the most common form of skin cancer we see is called basal cell carcinoma. Okay. The lay term used to be called rodent ulcer because it was very slow growing, and like a little rat, it would just eat away at your skin. Depending on location determines how nasty it is. So if you had it on your general body, it's not such a big issue, but around the eyes, nose, ears, that's where people potentially lose their eye.
Really?
Yes.
And is that actual cancer?
That's an actual cancer.
Yeah. So you have to cut that out.
In general terms, you have to cut them out. There is a subtype which is very superficial, for which creams and photodynamic therapy can work for. But once they go in deeper, then surgery is generally the most commonly used treatment. Unless you were really frail or inoperable, then sometimes radiotherapy is used. I mean, there are some people who get multiple basal cell carcinomas, and that's generally a genetic disorder, and there is a medication that can help to shrink them. But that has significant side effect.
So are you saying people actually get it on, you're talking about around your eye or in your eye? People get cancer?
It won't be in the eye,
No.
but it can be right next to the eye, so where the tear ducts are.
Right.
So it will just keep going in deeper and deeper. I remember, we don't see it very often, but maybe going back 10 years ago, we had one lady come into the hospital who had just neglected her cancers. Her eyeball was almost hanging out because the cancer had eroded right through her nose. And, there are pictures. If you Google it, you'll find pictures of that sort of thing. Slow growing, but ultimately it can be devastating.
So, and is there a third type of cancer?
Well, then from basal cell is squamous cell cancer. So squamous cell cancer is a rapidly growing skin cancer. I think Richie Beno had a rapidly growing squamous cell cancer that spread, and that ultimately causes demise. They can appear from nothing to something within a couple of weeks. And again, depending on location, can determine how aggressive they are. We commonly see them on the head and neck. I'm always telling people, or men that have no hair, to wear a hat because that's a very common location for it.
And is there something beyond squamous cell?
Then the next is melanoma. So
Right.
melanoma is the most common of the really bad skin cancers. So if you were to say to me, which skin cancer would you pick to have? You'd always pick to have a basal cell. Next, after that, squamous cell. If you have it adequately removed, that's the end of story. You don't have to worry about it. But melanoma is the cancer where even sometimes when you pick it up early, there's a small percentage of patients, maybe 1 or 2%, it will come back again, sometimes even 10, 15 years later. So you can't say just because it hasn't been there for 5 years, you're cured.
So if I was then to say to you, well, I'm not in a position to go and see a dermatologist. I don't really want to go see my GP, but because I don't think I've got any of these things, how would I identify all 4 of those? You already explained how do you do the first one.
Yeah. So I guess it's whether or not you observe yourself closely. So
we should, shouldn't we?
Right, we should be. But it's like, you look for change, things that weren't there. If something's appeared and it wasn't there before, you should get it checked. If something starts to bleed, like typically for basal cell, it's something that sort of bleeds, forms a scab, then heals, then it starts all over again. So it never fully heals. A squamous cell is often tender. Okay, so you'll feel like a boil, but instead of being like a boil that sort of oozes past and then settles down, it keeps growing. And then melanoma is generally, when you get them early, they're like a flat patch of pigment. So they're smooth, but they're just like a stain on your skin. You say, where did I get that stain from? Why is that stain multicolored?
So you told me about a code, A, B, C, D, E.
So commonly it's taught as A, B, C, D, E for melanoma. So A
that's for melanoma, right?
That's for melanoma.
Right.
Yeah.
So what is A? What do these things stand for?
So A is asymmetry. Okay. So if you look at the spot and you cut it in half, does one half look like the other half? So generally melanomas are asymmetric.
So in other words, they're not the same on each side.
Correct. B is for border. So a border that is irregular, so almost like a coastline, it's got ins and outs of it, is not good. You normally like to see a fairly smooth border.
So just on that one, on B, when you say fairly smooth border, you mean you don't want it having little bays?
Yeah,
like a little harbour
or inlets. Yes,
yeah,
inlets or outcrops.
You want it to be nice, like pretty much like fairly round or smooth.
Yep, correct.
Okay.
The next one is color, and again, you're looking for asymmetry of color. So from my perspective, it has to be at least 3 colors. Okay, and any of those colors, even light brown, medium brown, dark brown, pink to me is a significant color. So often people don't relate to pink. Most melanomas that I see are not black. So It's out there that, a black more is dangerous. well, that's the exception. For me, that's the exception rather than the rule.
In your experience, is that right?
Yeah.
So
Well, I'm
mostly,
trying to pick up the ones that people don't know they have.
yeah. And see, a D?
D is diameter. So it's quite a crude measure. Generally, anything that's bigger than about the end of a pencil, you would pay attention to.
What about those people who just use iPads these days? They don't have a pencil. They don't know what the end of a pencil. You and I
I
know
hope
what
they
it
would
is.
know what the end of a pencil is. But
A couple of millimeters.
so we say 6 millimeters.
6 millimeters. 6
millimeters.
Okay,
Yeah.
6 millimeters. And so the E.
E is for elevation. Well, there's 2 E's, elevation. So generally,
As in raised.
Raised. So generally, to me, a spot that's always been raised, the risk of that being sinister is very small.
Right.
Okay. So I'm more interested in marks that are smooth, that you can see, but you cannot feel. Okay. And then E is also for evolving, so changing. So that mark may have been at one stage round, now it's not round anymore. Or let's say it had 2 colors and now it's got a 3rd color. I would use that.
So A, B, C, D, E. I mean, that's a pretty good reference point for people just generally. But you're only going to see what's on the front, unless you got some way of looking what behind you.
That's
behind
correct.
your back. And skin cancers don't necessarily have to be in places where you've had sun.
Correct.
It can be anywhere.
They can be anywhere.
It could be on your butt. It could be on your bottom of your foot.
Yeah. So I've removed skin cancers from virtually every part of the body. So armpits, genital area. You know, I don't always look to check genital area. People say, look, I've got something there. Can you have a look? Then I look. Okay. But you can be unlucky enough to have a melanoma that's in the back of your eye, or it could start in your gallbladder, or it could start in your vocal cords.
Inside your body.
Inside. There are pigment cells inside your body. They're not the same. There may not be the same genetic subtype of melanoma, but there are pigment cells throughout our body. It's just that the skin has the most pigment cells, and therefore statistically the risk of one of those turning malignant, particularly if you've had sun exposure, is much higher.
Right. And is that because, so if I could just rephrase it perhaps, is it because you can get a skin cancer on maybe virtually every organ, but your skin is your biggest organ?
Yes.
And that's just the organ that you're mostly dealing with.
Yep.
And it's also the one that's exposed to the sun. But irrespective of that, you can get a skin cancer on some other organs.
Yes.
And
a type of skin cancer.
Yeah.
You know.
But
yes.
how would someone ever even know?
Well, that's why generally on the skin you can pick up and diagnose these things early, you know, because we can see with the naked eye. Those other ones, generally by the time you are symptomatic, you're in trouble.
Yeah.
Okay. So, you know, every year, every major teaching hospital will have someone present with metastatic melanoma in their brain, and there's no history or sign of anything on the skin. People presume that it's coming from an internal melanoma.
It's funny because my father passed away last year, and when they did the PET scanner on him, they said he had cancer everywhere, but like virtually every part of his body, including his skin, but in his brain as well. And but nobody could tell us where it started.
Where the
primary cancer was, because unfortunately passed away very quickly, but which is good. But one of the things he used to do all his life, and born in Greece, lived no such during the war, no such thing as anything put on your skin, and probably outdoor. He was a farmer. He lived outdoors, and then but every day of his life in Australia, he would sit outdoors early in the morning, from 8 in the morning to about 9:30 in the sun. Mm-hmm. Because he had this great north-facing backyard in Mossman. It was just so beautiful to sit there, especially in the winter because it was always warm. And he took the view that he said it kept him alive. And it's funny, there are some scientists now, particularly neuroscientists, out there saying that we should look into the sun first thing in the morning, like not at lunchtime, but they're talking about, get 20 minutes of sun into our eyes, onto our skin, etc. And my old man, he believed in that, but not for the scientific reasons. He just more anecdotal. Is that something that people should be considering? Like, do you think, is it ever safe to get sunlight on you, or is it the morning sun or the late afternoon sun? What is it?
Well, I think it's safe to get some sun on your skin because, traditionally that's how you get your vitamin D.
Yeah.
But, over time, if you think about what humans wore many centuries ago, they wore very little clothing, so they had plenty of skin exposed. They get enough vitamin D. And with fashions, we now protect our skin more, so we're getting less vitamin D. So getting some sun exposure is important. But the areas that are easiest for to get sun exposure are the areas that get sun all the time. So they're the ones that are going to be more damage. So not just from the risk of skin cancer, but the risk from your skin getting thinner, not looking so good, looking more wrinkled, more discolored. That's what the sun will do to you.
So what would you say about that? Because I know a lot of people doing this, and there's a lot of discussion about it on various channels. What would you say to those people who say the first thing in the morning you should get 20 minutes of direct sunlight? Now, they say first thing, and they usually say before 8 a.m. in their defense.
So I would say that your chances are you won't get burnt getting that sunlight first thing in the morning, but the sunlight at the beginning of the day and the end of the day, that's when there's the most UVA light.
In the first thing in the morning, really?
Yeah, first thing in the morning and last
Why
because
is
the
that?
sun's further away, so it's how the rays penetrate.
Wow.
That's what I understand. And so you're getting more UVA light. UVA light is the light that pigments your skin. And if we then look at, at one stage we had a lot of people going to tanning salons.
Yeah.
Okay, so tanning salons basically had UVA type lights, so you would tan without getting burnt because we're bypassing the UVB. You took the UVB out of the equation, you're getting UVA light. And then we started to get reports of younger people getting melanoma that had, low risk factors. So there were Asian people getting melanoma from having all this UVA light. So the UVA damages your pigment cells more. Okay,
It gets in deeper.
It gets in deeper. And also the thing is that if you we all know that as we get older, we get more and more brown and white marks on our skin. So the more UVA light, presumably you're going to get more discoloration.
So that's it. I've got those some white spots.
Yes, loss of pigment. Yeah,
and loss of pigment.
Yeah, so they're white.
Yeah. So is that because of sun exposure?
Yeah, sun exposure.
So and what's happened? So the sun exposure has done what to that part of my skin?
Somehow the pigment cells there don't work.
Right.
So they don't produce pigment. So they stay white.
And it therefore mean because I have those, let's call them white spots. If I go out into the sun and I get exposed to UVB and UVA, is there any danger because I don't have any pigment
presumably
left?
they'll burn more easily. Yes.
Oh, that area will burn more easily. It'll go more
Yeah.
red or pink
Yes,
or whatever the
correct.
case may be.
Yeah.
Interesting. So, given the vitamin D conversation that it was a big conversation during COVID because everybody was sort of saying, you need to take 5,000 international units of vitamin D per day in order to beat COVID because allegedly everyone was locked in home and they couldn't get outside in the sunlight, especially those people who don't have the opportunity to live in a house. They live in an apartment and perhaps they don't have a balcony or whatever. How do people get enough vitamin D then if it's probably not a good idea to be there first thing in the morning or the last thing in the evening because most people work.
Yeah.
I shouldn't say that anymore. A lot of people don't go to work during the day. They actually work from home, but they end up going to the beach because they live near the beach. And I can tell you, this week it was packed, and I'm thinking these people are not at work. They're probably on their laptop. But anyway, so how do people get enough sunlight? And is there a recommended enough amount?
Well, I think it's recommended that in summertime, somewhere between 8 to 10 minutes of sunlight on arms, legs, and face is enough to get you the vitamin D that you need.
Right.
When the weather's cooler, wintertime, because you have less exposed skin, then you may need up to an hour to get enough vitamin D. So, I take vitamin D supplements. That's what I've been told to do.
As do I.
Yeah.
But does that supplement, does that replace having to go into the sun, do you think?
Well, it can help reduce your need for the sun.
Yeah, in a physiological sense.
Yes.
As opposed to maybe psychological reasons.
Yeah, that's a different altogether.
And or recreational, etc. But but in a physiological sense, because vitamin D is necessary to create a number of other processes in our body.
Yeah. But I think the vitamin D story is not fully out there. I mean, I've been looking for, but I haven't seen it on research of what happens with the Middle Eastern populations. So the Middle Eastern population, they live in very sunny climates, but they're also very heavily clothed and protected. The women wear veils and stuff like that. So I wonder, do they have a problem with vitamin D in their society?
I was once the chairman of a listed biotech company, an Australian, but it operated quite heavily in Northern Europe. And we owned one of the biggest vitamin D deficiency protocols for pathology, and we used to look at the stats of Northern Europe relative to Australia, particularly in their winter, so many people would be diagnosed as being vitamin D deficient, which is where they would take vitamin D. We didn't sell vitamin D, but we just did the pathology. And whereas Australia we were never deficient, rarely deficient here, rarely. But it's an interesting discussion which is going on because 5,000 international units, that's actually quite a lot of vitamin D relative to other things that we take. And some people say even large amounts. But it's a very interesting conversation because it'd be much easier if you just walked in the sun from the train station to your office and got 10 minutes with the sun on your face.
Yes, but if we didn't live so long, that wouldn't be an issue. You could do that. Yeah. I think the longer we live, the more total sun you've had, the more sun exposure, the more damaged your skin is. So that's a payback.
And actually on that topic, that's a really interesting topic because I have read that, for example, just at sea level, we get exposed to so many, I think the measure is called CBITs or something like that
sieverts.
Sieverts is the measure of radiation. But it's not necessarily sunlight.
It's not
sunlight. It's a different type of radiation. Something we probably can't see. But and over a lifetime, there is an amount that, and of course, lifetime's a bit subjective, but they measured that they say the average lifetime is 80 years of age. Over a lifetime, you should only get 50 CBITs of this exposure. But then when you get in an aeroplane, you get exposed to much more because you're getting up much higher. That's why pilots retire early, but retire young.
And there is a study that's shown that airline pilots get more melanoma.
And I was going to ask you on that topic, is there studies equivalent in terms of sun radiation or sun exposure that we, like in a measured sense, that we should be able to, we should know we shouldn't get that any more than that?
I don't think so because I think there are too many variables.
Yeah.
There are genetic susceptibility. So there is a genetic disorder that these people aren't born with the right enzymes to repair DNA damage. And these children will start getting solar keratoses, non-melanoma skin cancer. Generally, they're dead by the age of 20.
Whoa.
Okay, because these things just go ballistic.
Well, how do you know? Say someone's listening to this and they just had a child's 3 or 4 years of age. What are you looking for?
Well, they will come in because they've developed sunspots. They'll start to develop rough skin. Why have they got this rough skin?
A sunspot being the rough skin.
The rough skin.
Yeah.
That would be the first sign.
But they're not born, David, with a certain type of skin. They
look like normal until their skin starts to change. They'll start to freckle more easily. So their skin is not, as they're growing, they're not aging the same way as we would expect.
Wow. So if I could just talk to you about skin for a moment, I mean, a bit more detailed. In Australia, and around the world too for that matter, there's the big debate about statins.
Yep.
Because, if your cholesterol is more than, whatever it is, 6.5, and your LDL and HDL measures, are sort of outside the range. Of course, ranges are very subjective and we don't really know whether the ranges are right or not, but it doesn't matter. Let's just accept the ranges from a pathology point of view. And the first thing that happens is your GP puts you on a statin. And it could be any type of statin, but let's assume it's, one of the usual ones, Crestor, one of those sorts of things. And I was reading somewhere that our skin is, 30% cholesterol. Mm-hmm. It's got a high amount, a fair amount of cholesterol in it, like our brain does too. Mm-hmm. Is there dangers about taking statins that may somehow end up having reference in your skin's ability to withstand radiation effects or even just aging?
Okay, not that I'm aware of. I'm not aware of that.
Because it's an interesting idea because if we don't have enough cholesterol in the body, something might not work. Who knows? Like someone says to you, take 20 milligrams of this.
Yep.
Mark.
Yep.
But it's not customized for me.
No, it's not.
It's not because no one's saying, well, we'll give you 20 milligrams of this and we do a blood test tomorrow. And by the way, you can go down to 19.5. It's not titrated up or down relative to the effect on cholesterol. And no one really knows how much cholesterol I actually need in my system for cells to rebuild and get on with their life, including the skin. Is there does your industry, your specialty, ever think about these sorts of things, or do you just sort of say, look, that's a hard issue. That's for the cardiologists?
No, I mean, I think, so with any medication that comes on the market, side effects are reported. Initially in the research stage, every single thing that happens to the patient is recorded as a potential side effect. And then once the drug comes onto mass market, then there's feedback as to what's happening. So we do see very rare drug reactions from different medications. And the higher it is, then that may lead to the medication being withdrawn. So we do see some side effects from statins. So people can get hives or urticaria from it. They may get a bit slightly dry skin, but we don't have any, major safety signals that should show that it's a problem. But sometimes these may not show up for 10, 20, 30 years. Currently, one of the very popular drugs that are used for treating blood pressure is called a thiazide diuretic. Okay, it's often used in combination with a lot of other blood pressure lowering medications. But research from about 3 or 4 years ago showed that anyone that's on one of these thiazide diuretics, it makes their skin more sun sensitive. And so the group of patients that are on this, with fair skin and so on, it can increase their tendency to develop sunspots as well as non-melanoma skin cancer. So routinely, when I now see a patient that's for the first time, they come in, if they have a significant load of solar keratoses and they're on that sort of medication, I will say to them, you need to talk to your cardiologist or your general practitioner. Think about if they could switch you off this medication. Now, if they don't have a burden of disease, then I'll say, we just observe you and see what happens.
So I think the same applies with some antibiotics as well.
Yes, some antibiotics make you sun sensitive too. And I mean,
state of the sun.
There are some heavy-duty antifungal drugs that are used often in people that are, transplant patients or immunosuppressed, and they increase the risk of skin cancer. It's well known, but you're juggling which is more important.
So can I just touch on that fungal thing, because you and I have discussed this. That when it comes to fingernails, that's considered skin. That's part of your territory.
That's part of my territory.
Yeah. So skin. So there are fungal diseases that you can get in your toes, and I guess probably in your hand fingernails as well. And there are a lot of things there that you can buy from various places to try and get rid of them. And I'm a bigger sucker in the world for Instagram, and I tend to buy things off Instagram. I shouldn't, but I do. And they, generally speaking, don't work. Can you just explain that fungal process that people get into their toes? And I had it. I'm one of the people that had one on my toes. Okay. So and how do you get rid of it? You suggested me some tablets, but they're pretty bad.
It's really difficult to get rid of fungal nail disease in the toenails. If you had in fingernails, that's much easier because the nails grow so much quicker. All right, but in general, to get fungal disease in your toenails, you probably tend to get tinea between your feet.
Yeah.
So there'll be a genetic susceptibility to why you get tinea of your feet. Okay, so when you walk around barefoot, so whether it's at a swimming pool, a gym, you go on holiday, you've rented a hotel room where other people walk barefoot, if they have tinea, then you'll pick it up between your toes. We wear enclosed shoes. So once your feet are in that slightly more hot, humid environment, that allows the fungus to grow. And then while the fungus is there between your toes, you then traumatize the toenail. So let's say you're lazy, you don't cut your toenails, the toenails are long, you have a pair of shoes that's tighter, you go for a run, you damage that nail, and that is how I believe the fungus gets into the nail. And once it gets to the nail, it just, you usually see it as a yellow streak going towards the nail cuticle. And because the toenail is so slow to grow, you think of how often you would cut your fingernails compared to cutting your toenails. And the fact is that you keep wearing shoe wear, you keep traumatizing the nail, it's really difficult.
And at the end of the day, what are the ways to get rid of it? I mean, I went and did heat treatment.
Yeah, so the treatments, I mean, you could use paints. The problem is that the paints often can't penetrate the thickness of the nail plate to get rid of the fungus. Okay, but you'll see those things advertised or available at the chemist. The next thing would be oral medication. So there are drugs around. There's one drug that the government does subsidize for, but you need to take it for a good 3 months. It has the risk of sometimes irritating or damaging your liver or your kidney. So to me, and the cure rate is like 40%. We're not talking about 70 or 80%. So if you're going to have to keep taking it, what risk are you doing to your liver or kidney? We don't know. So if you were taking it, you would need to have blood tests. And there are a few other drugs like that, but they all have their issues. Even the one that is the safest, you probably would need to take it for at least 12 to 18 months continuous to try and get the nail out.
Yeah,
okay?
So that's crazy.
There are laser treatments. So a lot of podiatrists do have lasers. The lasers sort of heat up the nail to an extent where it kills the fungus. It's painful and expensive.
Yeah, I've tried it. Yeah. I tried it. It was painful and expensive.
And did it work?
It didn't work.
Oh, there you go.
Because it came back.
Yeah, it comes back. It comes back. So because the fungus can live in dead skin, so that dead skin will be in your carpet, it'll be in your shoes. You just traumatize the nail.
That's what they told me to get rid of my shoes. They said throw away your shoes, throw away your socks, and start all over again.
Yeah, but that's an expensive exercise.
That's an expensive exercise, and it's okay if it's going to be 100% successful.
Yes, but then you have to make sure that you never walk barefoot.
Yeah.
Where other people walk barefoot.
So it's a sort of a genetic susceptibility to it.
You sometimes see families of people that are really bad, nail fungus, and there'll be someone in the family, let's say the wife doesn't have anything because she doesn't have the same genetic material. The father's passed it on to the kids.
So given, and then you've just indicated that genetics actually plays a role in relation to skin cancers, and your propensity was a person's propensity to get a skin cancer. It can be genetics. Can it also be like part of your environment and your social exposure to sunlight, etc.? Are there other foods that can cause skin cancers? Are there things we might be eating?
So I don't think so much from eating, but if, one of the things that causes lip cancer is spicy food.
Oh, really?
Okay, spicy food, alcohol.
So when your lips burn because you're eating chili?
You're irritating it all the time.
Right.
So repeated irritation on any part of your skin can lead to a cancer developing.
What about these people who get the lip injections to make their lips fatter?
No. Well, that's not an irritant.
No, but they look when I see them, they look irritated. It looks red, you know what I mean? Like,
oh, they're puffed out. They're puffed out.
But that's not an issue.
But as far as we know at this stage, it's not an issue.
Right.
But one of the classic things that we're taught at med school is that in New Guinea, people chew the betel nut.
Yep.
Right. As a habit, and they have an increased risk of lip cancer from chewing betel nut.
Okay, that's very interesting. So, if I were to ask you, okay, David, I'm a 30-year-old person. To date, I haven't really had too much exposure to the sun, just a bit of average. I haven't really been burnt too many times, once or twice. What are the tips that you would say to me to give myself my best possible chance to prevent skin cancer, and put aside annual checks and, getting checkups, the obvious?
Well, I think the thing is, whenever you're going to be outdoors, take precautions to not get sunburned. Every sunburn you get is going to increase your risk of skin cancer. If you're a male at 30, if you're thinning, always make sure you wear a hat, even if it's a baseball hat, to protect the top of your scalp, because the scalp gets direct sunlight. So it gets
even if you've got a lot of hair.
If you've got a good head of hair, that's fine. But if you don't, wear a hat. I think that, and for most men, by the time they realize they're bald, they've been balding for some time. And that's when they do most of their damage.
Yeah, that's mad. Yeah, right. I actually feel like a bit thinning myself a bit.
We all thin as we get older.
Yeah. So I should wear a hat.
Yeah. So a good, easy way for you to tell is when you come out of the shower when your hair's wet and flat, get someone to take a photograph of the top of your head. See how much bald scalp you can see.
And should they be looking for discoloration, or do you get it? Does it actually get like a something that's red or something that A, B, C, D? Will one of those be on your head?
They can. So if you look at someone that's still has a bit of hair and they've had sun on their scalp, you'll see that the scalp looks pink. You'll see that it probably has pigment in it, so they have little tan freckles in it, and sometimes they'll start to get the solar keratoses.
So what other things should they be doing in terms of tips for prevention?
I think, if they're going to be outdoors, let's say they enjoy surfing, golfing, whatever, I'd say to them, try and cover as much as you can. You can now get sleeves, you can get surfing hats, wear a rashie. It doesn't matter if you think you look stupid. If you're a good surfer, people look at your style. They won't look and say, what are you wearing?
If they're more interested in how well you ride the wave.
That's correct.
Unless you're bloody hopeless, and then they might look at what you're wearing. And in terms of sunscreen, we hear about SPF 50 and 50 plus, and then you hear about something. Someone will say, "Well, hang on, but that particular sun cream's got something else in it that you shouldn't be putting on your skin." For me, I find it extraordinarily confusing. I don't know. There's some people say white zinc, pink zinc, go back to the old days. Mm-hmm. But you can't even get the stuff off. If you put it on once, it's going to be there for a week, especially with some of the nose as big as mine.
That's probably good.
Yeah. So what do you say about sunscreen?
In terms of my general advice, when you have to use a sunscreen, so you can use clothing to protect as much of your body, so you don't have to put sunscreen all over your body. Okay, so I think, even when you have sunscreen on, it gives you good protection for maybe 45 minutes to an hour in the summer. It does not give you good protection for 10 hours if you're out there, because there's I call it a law of diminishing returns. If the sunscreen blocks out 99% of your light, you're getting 1% coming through your skin. If I said to you, look, I'm going to give you 1% of $1, 1 cent, you say that's really generous. If I give you 1% of $1 million, you'll say, oh, I'm interested now. So the quantum of light changes. Okay?
Right.
And then I would always say to you, use a 50 plus sunscreen. So the laws regarding SPF varies from country to country. In this country, in order for the sunscreen to meet the 50 plus requirement, it has to have a minimum of a 17 or 18 rating for UVA protection. Anything lower than that, it doesn't necessarily have to have any UVA protection. And as you may remember, I was talking about UVA as a longer wavelength light hitting the pigment cells. So that's why I think having the 50 plus is important to protect against the pigment.
And what about little kids?
Little kids the same. Clothing as much as possible. There are toddler sunscreens that are rated safe by the government.
And Australian sunscreens, are they, generally speaking, would you say they are as effective as anything you can get overseas?
Absolutely. So in the laws, often people say, look, I got an SPF 100 in America, but that SPF 100 may be against UVB light. It's not necessarily against UVA light. And you'll find some of the sports sunscreens here in Australia, they're rated at over 100 SPF as well, but they're not allowed to market it as such.
Okay, I just want to move maybe slightly different now. Let's talk about, well, first and foremost, what's the difference between you and a plastic surgeon?
So there's a big difference. So I mean, as a dermatologist, part of my, I guess, dermatologists may be purely medical based, so they're looking at skin diseases rather than skin cancer. There are some more surgical dermatologists that do treat a lot of skin cancer. There are cosmetic dermatologists that do a lot of beauty treatments. So those would be the three main groups. And then you also have pediatric dermatologists. They treat diseases that we see in the skin that are in children. A plastic surgeon, again, they would vary. There are plastic surgeons that are more interested in doing cosmetic stuff like facelifts and that sort of thing. There are plastic surgeons that are more reconstructive surgeons. So if you've had to have major surgery from an accident, they're helping to reconstruct that. And then there are plastic surgeons that will do skin cancer work. So if you have a skin cancer in your ear or your nose and it has to be cut out, there's a piece of tissue missing. How do they replace that piece of tissue so that you look fairly normal, so you don't look disfigured? Now, when dermatologists first started, they didn't really get trained in proper surgery. But, from when I started dermatology, there was a push because there's just so much skin cancer work and not everyone can afford to go and see a plastic surgeon. And so we started to do more and more surgical procedures. So
this is in your surgery in Bondi Junction.
Yeah. So I do surgery on all parts of the body, face, nose, all that sort of stuff. But I know what I can do and what sort of result I can give a patient. If the patient is happy for that to go ahead, then I go and do it. If it's a young person, I say, look, for whatever reason, I think the plastic surgeon you'll feel better and more comfortable with, that's who I'm going to send you to. I don't need to do everything that I see.
So you can diagnose it.
I can diagnose. So to me, it's always, if you make the correct diagnosis, then the correct treatment will follow.
If I then go on to aesthetic dermatology, if I could call it that, if someone does something, for example, what do they call it? Laser treatment, laser. Does the laser treatment, apart from, well, maybe you could tell me, does it make your skin better? Does it work?
Yes, lasers do work.
Yeah.
But, again, it's like you're choosing a tool and using that tool to treat what you've diagnosed or what the patient wants. So there are many different types of lasers. There are lasers that treat broken blood vessels. So, one of the things that in a sun-damaged skin, particularly in people that have fair skin, you start to notice that they have lots of little red lines on their face.
Well, I got some here, and you pointed out something here last time I saw you.
All right.
You said you might have, there's like a purple thing or a blue thing. You said you might have to get rid of it. Yeah. Is that what laser surgery would get rid of? So
yes, vascular laser can get rid of that.
Right.
It sort of seals the vessel. But, people have to understand the reason why they developed those vessels, and that basically is from sun exposure. For anything that, when you exercise and your face goes more red, you have spicy food or alcohol, your face goes more red, those vessels are getting stretched. So over time, some will always come back. But that's vascular laser. And then you have lasers that are designed to treat pigment. So let's say you had a brown marks or dirty marks on your face. You didn't like that. There are lasers that are designed for that. There are lasers that are designed for hair removal. So people that don't want hair, or girls that don't want hair in their armpits or their legs, they'll spend the money and get that done. If you've got scars, scars from acne, scars from surgery, you can use what's called fractionated laser to help blend the scar.
So do any of these things make your skin younger?
Well, yes, particularly I guess if you have brown marks and red marks on your face, evening out the skin color will make you look clearer. It makes your skin look younger. It's like if you were to look at the inside of your forearm. All right, the inside of your forearm, the skin's much more one-colored, and it'll feel smoother to you than the exposed side. So if we were to give you that on the exposed side, it would take years off your physical
You look
age.
younger, but is your skin actually younger is probably my point.
So if you were to do what's called ablative laser, so when people actually burn the skin, that stimulates collagen production. So there are some lasers that break the skin, and there are also lasers that don't break the skin, and they stimulate more collagen. So yes, if you were to cut a piece of skin out and look at it, the treated skin is more youthful.
So could you just talk about the collagen for a moment? And you can buy products in shops that says collagen peptides, which is a powder. You just put some water with it. How does collagen fit into the program here? Because is collagen about, do the bodybuilders use it, or is it just for skin repair? What's the deal with collagen?
Well, I don't think you can swallow it or eat it to help build the collagen in your skin.
Wow. So in other words, it's not bioavailable.
Yeah, your gut would just break it down.
Right.
All right. It might use the nutrients or something else, but ultimately the skin cells make the collagen.
Right.
All right. And there are different types of collagen. And over time, some of the collagen degrades. And so it's like the trauma, all right, of the burn stimulates the collagen to be produced. The fact is the cells say, hey, we've got to make new collagen.
And
so you can't eat it. You can't put it on your skin.
You can't you can't apply it topically.
You can't apply it topically. You can inject it. Okay, so that's fillers. Okay, but they're not, the current fillers that we use are all mostly what are called hyaluronic acid fillers. They're not collagen.
They're not collagen.
No.
But how would someone get, so you gave one example, but how would someone get more collagen into their skin? Like, is there some way to do that?
Irritate it.
Irritate it.
Irritation stimulates collagen production.
Well, and what is that process? Is your body fighting back? What is it? Like,
I don't know why it does, but that's what people observe. So any sort of, even if you have a superficial burn, so it's almost like, if you burnt your skin, when that scab comes off, the new skin looks much healthier than the skin that was there previously.
So therefore, some of these treatments, like laser, sounds like it's pretty hot. It sounds like it's burning. It's a burning process. Yeah. So maybe these things do stimulate the production of more collagen in your skin.
Yes.
Therefore, making your skin, it obviously doesn't go back in time. It's not, you can't reverse
it plumps
age.
up your skin.
Yeah, it just creates more things that would be normally there if you were a younger person.
Yes.
So
yes.
you are getting the younger person effect.
Yes.
Your skin hasn't got younger, but you've got the younger person effect.
Yeah.
So, because I watch all these Hollywood stars and I think, my God, like they look like some of them look younger now, 30 years than they did 30 years ago.
Mm.
And I think, what are you doing? I mean, it's maybe the lights are good and the makeup's good, but still, like I can see they got no lines. They got no lines on their face. They're not like me, they look awesome. How do they do that?
Well, it's probably a combination of things. It's not just one thing that they're doing. So, it depends on what their age is, whether or not they've had a facelift. Okay. So I often say, if you want to look at someone closely that they think, oh, gee, they look really good for their age, have a look at their neck. Okay. The neck is probably the most difficult place to improve. There are treatments for that now too, but it's hard to improve. If you look at the neck or the décolletage of a female, then you'll sort of often see it's much more sun damage because they've never had the same protection there. And then there's usually a combination of Botox, okay, to smooth out the skin, fillers, all right, to plump up the skin, and various other lasers, all to get rid of freckles. One of again, using analogy, Morgan Freeman has a lot of little brown dots on his face at one stage. He's had those zapped off, so his skin now looks much clearer.
And you would think by laser?
Yeah, by laser. Yeah.
And so
we do that. I mean, I do that to patients.
Yeah. You have that process in your business.
Well, for patients that want to have it done.
Yeah. So I don't know if you follow this guy or if you've ever watched him. There's a guy called Brian Johnson.
Oh, I think is he the fellow that's also had stem cells injected from his son or something like that?
Yeah. And he's had sort of transfused or taken blood from his son and put it into his own system, and he in turn actually put blood into his own father. Brian put it into his own father, which is interesting. Right. But the guy, when I look at his skin, like he's hasn't got a freckle on his whole body because he's always got his shirt off. There's a new series on Netflix with him in it. His skin looks like basically perfect. Like it's nearly translucent to me. It looks like I can see through it nearly. And his face is like perfect. Like he's 18 and he's like mid-40s. And I wonder to myself, what does someone like that do? I mean, he's sure he only eats once a day and he only eats in a certain time of day. And but he's only been doing that for a few years. He hasn't been doing that his whole life. He restricts his amount of sunlight, etc. If you were to speculate, what sort of things would someone like that be doing to get himself in such perfect condition? Is he eating something like, is fish oil really good for us? All those sorts of things.
I don't think there's any supplement that's been proven to be really helpful for the skin. I mean, the only supplement that I routinely would tell patients to take is nicotinamide. So there's some studies that show nicotinamide reduces the incidence of development of solar keratoses and skin cancer. But I'd suspect that he's having some sort of laser work done.
Yeah. So, but is that dangerous?
It depends on what sort of laser he's having done. But I'd suspect that initially he probably had a more invasive laser procedure, and it's down a much simpler maintenance.
Just maintenance.
Program. Yeah.
And what role does drinking lots of water play?
I think it's good to hydrate your skin, but I think that's probably it.
Hydrate your skin or hydrate yourself? Hydrate
the whole body.
Yeah, so you can't hydrate your skin though, can you?
Well, you're always losing water through your skin. So, even if you're sitting here, it's cool, there's a degree of water loss through your skin. So if you're not drinking water, eventually that's going to dry.
Yeah. So, but the hydration of your skin though is through water, intake of water. Internally. There's no way you can hydrate your skin from the outside, is there?
Well, yes, you can. I mean, basically, if you put on a moisturizing cream, what that moisturizing cream is partly to clog the sweat pores, so that the moisture that's coming out of your sweat pores is then going to hydrate the skin.
Yeah. So So is that the sort of like the theory or the premise behind face creams?
So most face creams, that's what they do. There are some other face creams that work by lifting away some of the dead layer of the skin. So there's a dead layer of skin, and so you're then revealing the next layer of skin, which is more hydrated, that looks plumper. So there's those two variants to moisturizers.
Because I remember many years ago, not that many ago, maybe 15 years ago, you could go in some pharmacies, they sold a vitamin C, which is sort of as an acidic base, vitamin C, and you could apply this vitamin C to your skin, and everyone was raving on about it, saying it's the greatest thing ever. Probably what it was doing, because it was acid-based, vitamin C is an acid-based chemical, is probably burning the top layer of your skin off.
peeling off a bit of skin.
And it allegedly, therefore, it's probably stimulating, the formation of your skin.
If it irritates enough, yes.
If it irritates enough.
Yeah.
So that's interesting what you say about hydration, though. If I could just look at skin care, not about cancer, but skin care. What is a good regime? Or just wash your face with sunlight soap. What is it?
Well, the skin wasn't designed to be washed every day.
In other words, have an alkaline apply to it.
Right. And so, unfortunately, we see lots of eczema in this country because it's always said, cleanliness is next to godliness. So people shower every day. People have long showers. When you're young, it probably doesn't matter for the majority of us because we have enough oil in our skin. But as we get older, you find a lot of people end up with dry skin problems. They don't understand why their skin is so fragile because it's dry. And so, I think a good regime is not spending too long in a shower, not having it too hot, just using the alkaline soap for the areas that you need to for personal hygiene. And then if your skin is starting to get a bit dry, start applying a bit of moisturizer to it.
Yeah, but so in terms of our faces, in terms of managing ourselves, would it be fair to say unless you're sort of working in a grimy environment, down the hole, you probably don't need to wash your face with soap every day.
No, you can just warm water is fine.
Yeah.
Yeah.
And then does that then result in you getting perhaps blackheads or spots and things?
So if you were getting blackheads and so on, that means your skin's quite oily and the oil's not coming out, then you probably need to use a cleanser that gently peels the skin. You want to unclog those pores.
So can I just ask you about something about young men who get, let's call it acne, but just like active skin in terms of, pimples and bumps. Just so we understand this, and I've always wondered this, surely it's not because you eat too much chocolate and pizza and shit like that. I mean, has it got something to do with testosterone, or has it got something, with your if you're in puberty? How does it all work?
The main thing is testosterone. So, you don't see acne before puberty hits. And with puberty, you got a surge of testosterone. And that testosterone level keeps going up into your 20s before it starts to go down. And testosterone is what stimulates oil production.
And what happens then? Does that get clogged or something?
So if you've got all this oil coming out and it can't get out of the pore, because the oil is produced a couple of millimeters below the surface of the skin where it's a bit warmer, it's more liquid there. As it gets to the surface of the skin, it's a bit cooler. So like butter, it starts to set. And that's how the whitehead develops. When the skin separates on the top, then it becomes a blackhead. And then because it's like a stagnant pond of oil, eventually it might get infected, and then you've got your red pimple.
So it all starts though with testosterone.
Yeah. So, if you read about in Egypt when they had eunuchs, so the eunuchs were all castrated, and they all had beautiful skin because their testosterone never came to the fore.
Because they didn't produce testosterone. Well, you can produce testosterone without testes.
Yes, but not to the same extent.
But not much.
Yeah, not much. Your adrenal gland produces a little bit.
Just enough to live, but not much. And that makes sense.
Yeah,
that makes a lot of sense. So if I could just turn a little bit now back to the whole longevity discussion, not longevity discussion because I'm sick of the bloody word. Like I don't even know what it means. It's an elusive word, because sooner or later Mother Nature's going to get you one way or the other. And you're going to go down, and you're either going to go down from heart problems or cancer or some sort of metabolic disease or a brain disorder, all of which will, finish your days off. But if I go to cancer, and in particular skin cancer, what, you being a dermatologist, and I know you're very aware of your health and your own longevity, because as both you and I were similar sort of ages, we start to think of, we've had this discussion a few times, when do we pull the plug and in terms of work and take advantage of whatever's left. What do you think about at your age now relative to skin cancer? I mean, you're Asian genetics, so both parents Asian?
Yes.
Yeah. Asian genetics on both sides. So you would have a certain type of risk factor associated with you. What do you think about how you live your life from now on relative to sunlight and just making sure you don't get a skin cancer?
So I think genetically my risk of getting a skin cancer is pretty small. But I sort of think of the sun exposure is gradually aging my skin. So you're losing elasticity. You'll see, like, my mother, before she passed, her skin was getting thin, so easy bruising. And it's always going to be bruising on the exposed sites. So to me, it's the longer I live, I want to keep my skin in good order so it's not a source of annoyance. I play golf. If my skin got thinner looking for a golf ball, I scratch my arm on a twig and it starts to bleed. That would be annoying. And then if that's happening on your legs, then any break in your skin does run the risk of picking up an infection.
So is that a thing, is it though? As we get older, our skin gets like thinner.
Absolutely.
And because I remember my dad used to get bruises and cuts really quite easily.
Yeah.
When he was 90, 89. Is that's just normal process?
Well, it's again that aging paint.
Yeah.
Analogy. Your skin's getting thinner and thinner, so that paint is cracking and splitting. So, one of the things is if you put moisturizer on it, there's a bit more give and take there, but the skin is still thinner. So, if I often will do a demonstration to my patients where I sort of gently squeeze the back of their hand and see how easy it is to wrinkle their hand. I squeeze the exposed forearm. Again, you see wrinkles, and then you squeeze the inside of the arm and you'll find that there are much fewer wrinkles. But as people age, they will still have some of that. Yeah, you can't stop thinning of the skin.
So, because that's very interesting. There's nothing. It doesn't matter how much water we drink, how much olive oil we'll take. I mean, I've got Greek friends who keep talking about olive oil. Does that do anything?
I wish there was a dart that you could have that would increase the amount of oil in your skin. It would help fix a lot of kids that get bad eczema. It would help elderly people as their skin gets thinner, but I'm not aware of it.
So the amount of oil or moisture that your skin produces is probably really genetics.
Yes.
At the end of the day.
Yes, it's what you were lucky to be born with.
Yeah,
so,
yeah.
Often I will say to patients that got bad acne, you'll say, you might hate it because you got such an oily skin, you're getting all this problem. But guess what? When you get older, your skin is not going to get dry. You're not going to have, it's like a bit of your own natural sunscreen. You'll like it then. But at the moment, you can't see that.
Yeah, suck it up.
Yeah.
So just to finalize this whole thing, David, I really appreciate your time. What would you, one bit of advice or a couple of bits of advice would you give to the everyday Aussie who's out there living their best life, going to the beach, hanging out in the sun, maybe drinking too much or drinking a lot? Too much is a bit hard to examine. Eating shit food and then having some good food, exercising but not exercising enough, sleeping but maybe some nights not having enough sleep. What would you say to them in relation to their skin and their propensity to get unwell as a result of their skin? Not just look old, but just get unwell.
Okay. Well, I think all those things that you said are important. They need to exercise, they need to eat properly, they need to sleep right. All those things have a role to play in your skin. So there's research that shows if you have poor sleep, your immune system doesn't work so well. If your immune system doesn't work so well, it increases your risk of skin cancer.
Oh, really?
Right? Okay. Well, a risk of any cancer.
Yeah.
Okay. It's like a form of immunosuppression. So all those patients that we put on drugs because they've got certain arthritis or they're transplant patients, they get more skin cancer. Is
that right? Because you put on anti-inflammatory
medications that help them not reject the organ.
Yeah.
So we see that all the time
because they're immunosuppressant drugs. Because if you didn't put them on those immunosuppressant drugs, their immune system would be going nuts and they'd be getting aches and pains and all sorts of problems.
Yeah.
So you suppress your immune system, but that has another result.
Yes.
It causes potentially other problems.
Yes. And then there are, blood disorders, so some types of leukemia that people live with, okay, that affects part of the immune system. So they also get increased skin cancer.
Yeah.
So it's, so to me, it's always trying to make sure that your immune system is working properly, and part of that's sufficient rest, sufficient appropriate food. Otherwise, you are literally increasing your risk. And if one thing that people can do in this country is at least have a check of their skin, have someone look at your back just to look for things that are odd, get it checked. I mean, skin cancer in its earliest stage is so easily curable.
Oh, is that right?
Right. If you get them early, it's a scar and you get to live. I think, as I was saying to you, I've had, 10 or 11 melanomas this year. And, one of them, one of those young boy who I think he was only 16, he had melanoma on his back. So he's got a big scar on his back now from me cutting a big piece out. And you see it.
How often a year does one need to get checked? So I'm coming to see you. I'm actually due to have a checkup with you, but I probably come once or twice a year. But how often does an average person need to go?
I think parents will often ask me, when do I bring my children for a check? I'll say, look, when they're in their late teens, when they're not listening to you, they're in charge of their own health, just get a baseline. The baseline, the dermatologist or the person that knows what they're looking at should give you an idea of how much damage there is, what sort of moles they have, and how often they need to be checked. If there's nothing unusual, I'll say to you, come back in 3 or 5 years.
Right.
There's no need for a yearly check. But then you see people that have unusual moles or they've had history of already having had skin cancers. They can vary from, 3 months to 6 months to 12 months. I had a man many, many years ago, and he said, look, how often do I need to come back if I really was to pick up everything early? I said, you're going to have to be here every month. He's one of the only patients I ever diagnosed a breast cancer with. So breast cancer in a male. But yeah.
Is breast cancer for a man or woman, is it a dermatological?
There's a type of breast cancer, which is called Paget's disease, that it manifests in the skin around the nipple.
Really?
Yeah.
And is that just for men or for men and women?
Men and women.
Wow. Yeah. Is it a genetic sort of?
Again, I'm sure there's a genetic component to
it. Yeah. So, but as we get older, perhaps say someone's over 60 or even over 50, perhaps the cadence of their checkups, because getting a baseline is really important.
Yeah.
So in other words, a baseline, you go and get a checkup, and perhaps the doctor you see has looked at everything and he notices there's something there, and no big deal. He writes a note about it. So what's the cadence look like over 50? Is once a year?
So I think, again, it depends on what they have.
Yeah.
So to me, it's like as you get older, the number of things that are added onto the medical train increase. For a man, it's getting your PSA checked, colonoscopy, cardiologists. Those are probably the three biggest, along with the skin.
Yeah, so you because I know I come in at least once a year, sometimes twice a year. I think that there's for people who are listening, I mean, I think there's actually a comfort process as well for the patient. It's not necessarily for the doctor to tell you. It's what makes you feel comfortable if you're a patient as well. And it's important to keep going back to the same person.
I think, coming in getting checks like a bit of insurance. You don't really want me to find anything.
Yeah.
But if I find something that's early, I think if you have confidence in the person you're seeing, you should keep seeing them. But if you don't really like or you don't get along with the person, I'd find somebody else. I think it's important to have a good patient-doctor relationship.
What am I going to do when you retire?
There will always be someone else.
Hopefully I'll live longer than it takes for you to retire. But I'm serious. What am I going to do? You better start getting an assistant and someone who I can meet early.
So there's 8 dermatologists at my practice, and virtually all of them have trained with me, and I wouldn't have them working there if I didn't think that they were good at what they do. Well, so no one's indispensable.
No one's indispensable, that's for sure. But I've become used to seeing the one person all the time. So, and I will be coming to see you very soon. Dr. Dave Wong, thanks very much, mate.
Thank you for having me.